Welcome back to Masala Chais with Dr. Aunties. All these videos are hopefully going to be put on the month of May. So for all those mothers out there, happy Mother's Day. Now we're going to switch over to the medical system. Let's figure out the foundation where we exist now and why we're so critical of it. So the foundation of what we exist now is that there's a couple things. We're going to talk about the clinical appointments, and then we're going to talk about insurance and billing. So when you get pregnant, you go see your OB, and usually it's about 10 to 15 appointments before your baby's born. Like, that's how many OB appointments you have, about 10 to 15 roughly. But in our standard medical system, and midwifery is a little different, home births are a little different, but we're going to talk about just the standard medical system that most women go through and most women know about. Then, even currently, I know Medicaid has come out to increase postpartum coverage, but they have not defined it at all. Like, I read through all those 100 pages. Oh my God, and it's varied from state to state. So here's another issue. But currently, you don't go see your OB until 6 weeks. ACOG has come out with protocols if you have risk factors that you go in and see them earlier. Telemedicine was really nice that it came through postpartum due to COVID. However, there isn't payment. So let's talk about payment also. So usually it's global payment. So when you're pregnant, you are covered from pregnancy to postpartum. But some of those postpartum appointments might not be covered through your insurance. It just depends on your insurance. So I had this one incident. This mom had a home birth that failed, unfortunately for her. So she had to go into the hospital. Then she was diagnosed with postpartum preeclampsia. Since she did not get care in our traditional medical system, I couldn't find her an OB to take her, and she was on Medicaid because they missed on the global coverage. Like, it was the hardest thing. And this is the disservice that Nithya and I encounter on a day-to-day basis doing this fourth trimester care. Now you look at it from the infant side of it, okay? So from the infant side of it, we're just going to take up to the first 2 months, because then that covers the 3 months. You deliver your baby, you get discharged. Insurance covers about 24 to 48 hours for vaginal, 72 hours for a C-section, and then the day you get discharged, the day after, you have to go see your pediatrician, okay? Those pediatricians, and nothing against pediatrician, I'm one of them, it's our medical system set up that way. Unfortunately, they only have 10 to 20 minutes appointments. So in that appointment, and that appointment is very important. I'm never going to say that appointment is actually crucial, because you want to make sure that the baby's transitioning. However, there's no time to address breastfeeding issues. There's no time to address mental health of that mom. There's no time to even be like, hey mom, you okay? It's literally about, hey, we just want to make sure your baby's surviving type of deal, and there's not a big medical stuff coming on. Then you come back for the 2 to 3 week appointment, baby hasn't gained weight, boom. Again, unfortunately, our medical system's set up this way. Again, nothing to any of the pediatricians or anyone providing care. It's just, we just don't have time in our medical system to do proper preventive care. Then baby's coming back in a month, maybe they're still struggling with breastfeeding, supplementation's been kind of offered, and then the baby's seen at 2 months. So at a minimum, in the first 3 months that we're talking, your woman has had 1 appointment, and our rates here in Denver are not that great. It's like 52% of women might not show up for that 1 postpartum appointment in some of our communities. But your minimum infants have 4 appointments, right? 1, 2, 3, 4. However, we know while practicing that low birth weight, not gaining weight, jaundice rechecks brings those infants back in. An infant, even under Medicaid, is covered for the first years for all their well child visits and X amount of appointments. All you're doing is, one more thing and I'm going to stop. Then if you have lactation issues and this woman really wants to breastfeed, because that's the choice she's made. Now she either has to go to a group, find the right lactation person, make sure that this baby doesn't have tongue tie because that's like the fad of the year right now. It's just fragmented care. We're doing a disservice, literally making this dyad go find their care in a time of need when medical care really should be like, we're going to come to you, or we're going to help you out. We're going to look at this from a scope that is important and holistic to you. So I said a lot there, Nithya, but I wanted to lay down the foundation of where we exist currently. So
yeah. And I mean, that's the framework for typical care for, mainstream medicine right now in our country. And I mean, it's broken. I say this all the time. It's a broken system. It's broken for physicians. It's broken for patients. It's not doing anyone any favors. And I like to say, let's just get rid of it and revamp it, because I don't see another way out of it at this point. We've become so reliant on insurance-based care driven by algorithms and administrators, when really care should be driven by patients and physicians. And those things that originally were set up to support patients and physicians have now taken over and, disrupted and corrupted our system in this country. And so the solution, and I think this is a solution that Sonal and I see eye to eye on, is providing holistic dyad-based care and getting rid of all of the middlemen that are messing up care in our system, and really bringing it back to the physician and the patient. So Sonal and I both practice direct care. What that means is that you know exactly what you get from us, which is an invested physician who is there for you. And our only focus, our only goal is to make sure you and your family are successful in this transition. But we do it directly in that you pay us for the care that you're getting. So you know what you're paying, and you pay for what you get, which is excellent care. And the way to give excellent care is to give time to the care that we give people in this period. You cannot do this in fragmented 10-minute visits. Then you have all these 10-minute visits where no problems are ever addressed. And this is something I saw, doing family medicine in residency. Like, all these people were coming and they were seeing different people at different times, and none of their issues ever got addressed because nobody was looking at the entire picture. They were just trying to get through the visits because they had all this external pressure from administrators to meet productivity goals, and from insurance companies to do things a certain way based on someone that has basically no medical training telling you what you can and can't do. And so this system is totally messed up. It's time to burn it down, get rid of it, and build something new. And I think that the thing that we need to build is that patient-physician relationship needs to come back into the mix. And, doing family medicine, I'm trained to take care of parents and infants. And so for me, it's like that holistic system can exist. And, it's just like, when you take care of both people, and I think most people don't get this in training, but when you are able to take care of both people and are trained to take care of both people, you can see what a big difference it makes. I mean, I had patients in residency that would only deliver with me. Like, they would not deliver with other people because I had taken care of them for every pregnancy and taken care of them and their kids after the baby was born. But then it's like, then I knew them in this whole other way, I knew about their infertility struggles. I knew about their miscarriage. I knew about their older child that may have a medical issue that needs to be accounted for when we're counseling on the new baby and the birth. And so when you know all of the people in that family in that way, you are able to provide more holistic care in a way that allows them to reach their goals safely, and in a way that you can address their medical issues while also working to create a support system that allows that parent and infant to safely transition into their new life as a family. And I think that's what we're both doing with our practices. Sonal goes into people's homes. She knows them. She knows their family. She knows their living situation. And I'm doing mine virtually right now, but it's still the same thing. Like, I get to know my families. I spend at least 90 minutes on that first appointment. And that is the solution. The solution is not to keep adding appointments in the system that is not working. It's not working for doctors. It's not working for patients. The solution is to leave the system, go to a model of care where the focus is on understanding the family and understanding their dynamics so that you can help create medical care that works for them. So you can understand all the pieces and bring the pieces together. So instead of getting all these fragmented pieces of care that are not addressing the underlying issue, now we're able to say, okay, what is your goal as a family? And once we have established your goals, how do we reach that or get as close to that as possible? And you can't do that. Like, you don't have time to do that in a 10-minute visit. Like, it takes time to get to know people and know what their needs are. So yeah, I mean, it's the solution to me. The solution is get rid of all the extra stuff, get rid of the noise, get rid of all these artificial measures that are not really addressing patient needs, and refocus on that relationship between you and your doctor so that you can get the care that you need, your baby can get the care that they need, your spouse can get the support they need, so your family can succeed, or your partner, or anybody else that's involved if you're not married, you know, whoever is involved in your family, get the support you all need so you can succeed as a family.
So I have two things on that. I think you eloquently summed that up. One, our system is set up with insurance to provide, to be reimbursed for acute care, not preventive care. Like, that's one. And number two, I saw this meme recently. I'm like, it made me thinking, is like, literally when insurance companies are denying our suggestions or our visits or our needs for like cancer patient medications, can we sue them? Aren't they not practicing medicine without a license? Like, can we sue insurance companies now to be like, okay, you have no medical baseline? Like, how can you deny reimbursements? How can you deny care? Like, how is it that you are emergently somewhere else, but this is an out of network, you considered them out of network, so now the patient is due, but they had to go to the emergency room at that point just because they didn't know that anesthesia wasn't out of network. They didn't know that that nurse wasn't out of network. I mean, can we sue insurance companies now? Like, can we? I don't know. Like, I literally was thinking about that. I was like, oh my God, they really are practicing medicines without a medical license. And we would get sued if we did that. So, yeah. I don't know.
I mean, I think insurance companies should get sued for that. Like, anytime there's a medication denial and a complication related to it, the insurance company should be held liable for it. You know, I don't know how to go about doing that. And
yeah, maybe some smarter people know
yeah,
how
some
to
smarter
do
people
that.
than us might need to figure that out.
But
But you know, I
that's
think
the problem though. Like,
yeah,
why do we have to have a complication when we already know? And I think that's the part that bugs me too. It's like, until someone suffers, or until we show over and over again that things are not working and we're getting this, then we have to react. Like, why are we so reactive when we know the data, when we should be proactive at this, not
right,
reactive? You know, like,
right.
why should people suffer to be like, yes, I have paid thousands of dollars in deductibles to you, but you still won't cover an x-ray because the radiologist was out of network, but it was an emergency.
Mhm.
No.
Yeah, and I mean, it's totally insane. It makes health insurance in our country makes no sense. Let's look at, like, think about other types of insurance. With car insurance, you don't use your car insurance to go get the oil changed, right? Because then your premium is going to be crazy. This is why health insurance premiums are crazy, because we're told that we use insurance for everything. But with car insurance, you don't use it for routine things. But when there's a car accident, when there's a catastrophe, when there's something very, very expensive that happens, that's when you file the insurance. That's what it's supposed to be. It's a safety net. And so it doesn't make sense. Like, why are we paying health insurance companies $10,000 to $20,000 a year for coverage for our families, and then they don't even pay until you first meet your deductible, which is usually several $1,000s. Then you have cost sharing, right? Then you still have to pay like whatever 20% up to like $15,000. So, I mean, the out of pocket costs of having insurance are astronomical, even like, especially if you need to use it. It's so expensive and it makes no sense. And then they're also dictating care. Like, it's totally insane. And the other piece, tying this back into like kind of pregnancy and fourth trimester, you know, I think that they use this opportunity knowing that most young families are not familiar with the insurance system, and are not familiar with your rights under federal law. And I think they use that to deny services that are supposed to be covered 100% according to the Affordable Care Act. And I think they purposely do that, knowing that this is an overwhelming period of life for people that are not familiar with insurance systems yet, because most people having babies have not had to interact with the medical system very much until that point. And so, like, for example, like I've heard multiple stories where routine blood work, which the insurance is supposed to cover 100%, is denied by insurance companies, or it's filed, incorrectly by the doctor, which my job as a doctor should not be play the guessing game for what code the insurance wants. It should be like, these are the services that I know you need. And then the insurance should cover it based on knowledge of what a pregnant person is supposed to get. But that's not what happens. They look at it and they deny all this care that's like recommended and routine, which is supposed to be covered under the Affordable Care Act. They deny it purposefully, knowing that it's unethical to deny it because they can get away with it. Like, how messed up is that? We're paying for these benefits, right? Benefits that they're supposed to provide to us. And then they purposely make it such a complicated, convoluted system that they find all these loopholes to get around paying for the actual services that they're supposed to be paying for. So to me, that's totally messed up and unethical, first of all. But number two, like, why are we still trusting these people to drive our healthcare, right? Why are we doing this? So what we need to do, get rid of insurance for routine care, get rid of insurance for anything except catastrophes, which is what we use other insurance for and what it should be for. And then figure out a system where people, and this is already being figured out, people are already doing this, where you pay a relatively low amount of money to have access to a physician that knows you, that understands your family, and allow that person to help provide your routine health care, including things like pregnancy and delivery. And, we might need like that catastrophic insurance to kick in if there's a complication, or if you need a C-section or something. But for routine vaginal deliveries, why can't we set up a system where you know what your costs are going in, and it's not going to be $8,000, $10,000, $15,000, which are all bills that I've heard of for a routine vaginal delivery. Right. It should be like a couple $1,000s, right? And you know what you're paying up front, and you get that direct access, direct care. You get a physician that knows you, that's not tied up in figuring out how to bill something so insurance will reimburse them. Their focus is on your care, and you know what you're paying. You don't get hit with these huge bills 2 months after having a baby, where you can't even think about, like, is this a bill I'm supposed to get? Which part of the time it's not a bill you're supposed to get. And, then we can really focus on improving outcomes, improving care, focus on the medicine, focus on what you need instead of what an insurance company needs or a hospital administrator needs. Sorry, this is a little bit of like a soapbox for me. If you get
I know, I totally agree with you. Like, you say we pay in 10 to 20,000 deductible. I was just thinking when you were talking about that, my biggest package, which is for 1 month for 4 home visits, which are usually about, the first one's definitely 75 minutes. I mean, it's there, and the other ones last about 60 minutes. And you get direct access to me, so I don't have phone trees. You can text me directly. I'm going to be available for you. It's $12,000. I mean, not $12,000, $1,200. I mean, $12,000 would be a lot. $1,200. And if you're paying insurance $10,000 to $20,000, that's not even 10% of what you're going to be paying me for, literally like helping you with all the aspects of it, maternal wellness, pelvic physical therapy. Like, we bring so much to the table at $1,200. And you're right. Like, sometimes I'm like, oh, but yeah, it's a drop in the bucket for preventive care that is like, I'm going to be there for you. This is upfront cost. I'm not going to charge you anything extra. I'm not going to charge you. I even have a rule on my thing that if I feel the need to come back for a medical reason, I'm not going to charge you for that, because it's on me that I felt the reason that I needed to come back. So I'm not going to charge you for that visit. It's just like, let's kind of mirror what it is. Let's add one more in on there, because I know particularly for new moms, lactation's huge and we might need another appointment. Mm-hmm. But then you have options too, right? You can do a 1 visit or you can do 2 visits, but it's upfront and I don't charge anything extra. It's like black and white. So yeah, I'm not going to deny care. I'm not going to be like in the back end be like, oh, I did this, so I'm going to, like, no, just be upfront with it. This is what you get. This is what the value that you get for it. And yeah, I mean, when you were saying all that, I was like, wow, 1,200 looks like a drop in the bucket for all of this.
Yeah.
So, but I agree. I mean, I think we could even talk more and more on this.
Oh,
But let's kind of go back to the fourth trimester. We talked a lot about the dyad care and the reason that we need it, and the reason that is valuable, not only for, and one last point on that, I mean, it relates to infant and childhood development. You do right for the family, that child is going to thrive. And there's plenty of research out there for
mhm.
that. So just look that up type of deal.